here is your question. Right, so if you have read and understood, considering this clinical examination session currently begin.
I'll enter the room, I'll wash my hands, then I'll introduce myself. Hello, I'm Dr. Karma, one of the exam candidate. May I confirm your name and age, please?
I'm Samantha, 40 years old.
Hello, Samantha. So today I have been asked to examine your back and your legs. That will involve looking, feeling, and moving your legs. Is it okay with you?
Yes.
Okay, Samantha. So to begin with, I will need you to remove your gown. I'll expose the lower back, and then the legs. I'll ask to keep the shorts. And so, Samantha, before I begin, do you have any pain at the moment?
No.
No. Okay. So can we start by standing?
Yes.
I'll need you to stand for me. I'll begin with the inspection. I'll look from the front. I'll look from the front, and then I'll look from the side. And Samantha, I'll now have to examine you from the back. So okay. I'll look for scar. I'll look for any swelling, any deformity, any muscle wasting. Look the status of the spine, whether there is any scoliosis or lumbar lordosis or kyphosis.
Yes.
Samantha, if you have no pain at the moment in your back or legs, I need you to walk for me. I'll ask her to walk towards the wall, and when coming back, I'll ask her to walk on the heels and also on the toes. Now, Samantha, I'll need to feel your back. I hope you have no pain. I'll feel the temperature of the back, temperature of the spine with my dorsum of my hand, and I'll feel the tenderness along the spine and the paraspinal muscles. And then, Samantha, I'll need you to do some movements for me. Okay. I'll first of all, can you move on your sides where you try to touch your right knee with your right hand, and then same on the left side. Now I'll go on your back, and then I'll make a mark with my pen. I'll see the skin dimples, which corresponds to the posterior suprailiac spine, and then mark a 0.2 centimeter, so 10 centimeter above that, and 5 centimeter below that. I'll do the Schober's test. Now, Samantha, can you bend for me forward as far as you can go? So in normal patient, it should be more than 20 centimeter. Okay, thank you, Samantha. Now, can you turn up and bend your back? Don't worry, I'll not let you fall. I'll assure her. Then after that, Samantha, can you sit down on the sit on the examination table? Then I'll ask her to keep her arms on the chest and then move her body, seeing the thoracic spine movement on both the side, left and right. Now, Samantha, I'll need you to lie down for me. I'll make her lie down, and then I'll do the straight leg test. Samantha, I'm going to raise your leg. If you have any pain or discomfort, do let me know. I'll be as gentle as possible. And if you insist, then I'll stop the examination right away. I'll keep her knee straight, and then I'll slowly start raising her leg and both the leg, and then at the point where it's maximum 80 to 90 in normal cases, I'll then dorsiflex the foot. Then after that, I'll go for the lower limb examination. Samantha, now I'll need to test your sensation. Can you feel this? I'll use the cotton on her chest. So can you feel this? So you'll feel the same on your leg. Can you close your eyes and tell me if you can feel this? So I'll begin from L1, L2 on the anterior thigh, then L3 on the knee, L4 on the medial side of the leg, L5 on anterolateral aspect of the leg and dorsum of the foot, and then S5 on the lateral aspect of the foot. And also same with the pain with the neurotip. So this will be a bit painful. I mean, you'll feel a bit discomfort, but I'll be as gentle as possible. So same with the neurotip for pinprick. Now I'll need you to do some movement for me. I'll see the power of the thigh, leg, and the foot. I'll ask her to flex her. I'll ask her to push her thigh against resistance, and then I'll ask her to above and also below, seeing the flexion and extension of the hip. Same on the knee. I'll ask her to bend her knee, and then I'll give resistance. Ask her to pull her leg towards herself to see the flexion of the knee, and then push outside to see the extension of the knee. Same on the foot. I'll ask her to push downwards and upward for flexion, plantar flexion and dorsiflexion. And then finally on the great toe, I'll ask her to pull the great toe against herself. If time would have permitted, thank you, Samantha. Now you may dress yourself.
Please present your
if time would have permitted, I would like to examine the coordination test, see the reflexes and see the tone, and then also complete with the femoral nerve stretch test.
Yes,
and do a
leg
and
lifting,
clonus, and examine the cervical spine and the hip joint also.
Yes. What else?
So today I've examined done the examination over Samantha, 40 years old waitress who came with acute lower back pain. On examination, I found that on inspection, I found that she had difficulty walking on the heel, and also she had a restricted movement of back due to pain, and also on the straight leg test was positive on the left side. And
what was the gait?
She had waddling gait. Okay. And on sensation, there was the decreased sensation on the lateral aspect of the leg and dorsum of the foot, and the extensor
the range of movement.
The great toe was also, there was diminished range of movement on the lower back, and also there was tenderness on the lower back.
Yes, and the shoulder test was.
And the rest of the shoulder test was decreased
in forward flexion. And what about the straight leg raising test was?
The straight leg test was positive on the left side.
Yes.
On the left leg.
So what are your differential diagnoses for this lady?
From the examination, my differential diagnosis will be left lumbar 5 nerve root involvement due to disc prolapse probably, and I'll also consider spinal canal stenosis, diabetic neuropathy, vitamin B12 deficiency, which could lead to subacute combined degeneration of the cord.
How would you also consider spinal med.
To confirm my diagnosis, I will do a X-ray of the lumbosacral spine, AP and lateral view. I'll also consider MRI of the spine.
What treatment alternative can you offer to this patient?
first of all, I'll start with pain management and exercise. And if it doesn't improve, then I'll go for surgical treatment. The options are if there's since I'm suspecting disc prolapse, then I'll go for discectomy or laminectomy.
Good, good. Right. You already told me the things that you missed. So yes, in the beginning, you did very well, I must say. You presented yourself, you took the consent after confirming the name and age, and then you even instructed how much exposure you need. And you even instructed the patient that patient should be standing when you begin. When you were inspecting, you had to, when you were inspecting and you asked the patient to walk, then you had to also mention that if there was any walking aid or the crutches or anything patient was using.
Okay, ma'am. Okay.
Yeah, just this.
Yes,
all the rest. Yes. And when you were asking for the movement, did you mention, you told, okay, you'll do this, this, this. You will ask the patient to do active movements. But then I think you forgot to mention about the passive movements. Because you have to do both. First active and
of the lower limb, ma'am?
Even of the spine. And then lower limb as well. And the reflexes, yes, you did tell the reflexes. Leg
spine,
lifting,
I think only active movement, no, ma'am?
Of the spine, yes. And then the lower limb. Because you have to check
lower limb, yes, ma'am. Motor, yes.
Yes, power. So there you have to ask. So, good. Very good.